I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
If you're interested, we'll do it for you alone. You're the only one. That's fine. Now, we have some important things to say. Peter Reagan is here. Yes, we do.
Gentlemen, these are panel members of the consensus. Quiet, please.
The conspicuous absence of electroshock critics and survivors on the conference panel and its domination by pro-shock mental health professionals discouraged public debate. Its deliberations are therefore highly suspect. The committee, composed of mental health professionals and former psychiatric inmates, including electroshock survivors, opposes the use of electroshock. Our committee believes the following points must be made in any full and complete discussion of electroshock. 1. Electroshock always causes permanent brain damage. 2. Electroshock always causes permanent memory loss. 3. Patients' reports of memory loss and other severe effects, including loss of creativity and the inability to learn new material, are systematically ignored or denied. 4. The quote, improvement described by the shock doctors, confusion, apathy, and euphoria, is actually the result of the organic brain syndrome caused by electroshock. 5. Electroshock causes more suicides than it prevents. Ernest Hemingway is only the most famous example. 6. Electroshock causes a small but significant number of deaths. 7. Electroshock has never been proven to have any long-term, quote, therapeutic effects. In fact, no study shows that these effects persist more than 30 days following the last shock. 8. Informed consent to electroshock does not exist because shock doctors deny the procedure's harmful effects and because psychiatric institutions are inherently coercive. 9. None of these statements has been disproved by the American Psychiatric Association or the Consensus Development Conference. 10. The burden of proof must be on the shock advocates to scientifically and conclusively demonstrate the safety and efficacy of electroshock. The Food and Drug Administration should not grant the APA's petition to reclassify ECT devices from its current high-risk class to a lesser-risk class without conducting a full-scale public investigation. For these reasons, we call for an immediate moratorium on electroshock. At the conclusion of our statement, we have people available to answer your questions. I would like to say that after listening to what I've listened to for the last hour, I have been through 3 of the types of depressions that they have described. The severe, persistent depressions with loss of motor activity, with apathy, with physical bodily delusions, with the inability to work. The first of those depressions, I was hospitalized. I was given large dosages of psychiatric drugs. I was not fortunately given electroshock. I did not recover from that depression until 5 months after the hospitalization, after I had gotten myself off the drugs and was able to recover spontaneously. The other two concussions, which were severe but of much shorter duration, I recovered from spontaneously without psychiatric.
Do you have a copy of that?
Yes, we have many copies of it. Are we available? Leonard does.
Thank you.
Thank you. Any questions for any of us? Dr. Reagan, Dr. Frank, myself, have you
I want you to hear that too.
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope and you might make copies available for the panel. We're talking about having a police factor information on the device and what we're using. And the one copy is the Thymatron, the brochure on a single sheet handout on the Thymatron pulse ECT device. And in there it shows the physical characteristics. I've also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding like the truth in lending and what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1 pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol slugs. Now that is just pure factor data. To give that lifting of 1 pound energy equivalence in informed consent, how could you not do that? And if you're going to give a procedure, the total energy and the total time are the physical parameters that characterize the device. How could you not include that information? And if a doctor prescribes a drug, he has to record the prescription. Why isn't the total time and the total energy recorded? This has been an experimental hazardous device for years now. Why hasn't this information been gathered that we could be talking with concrete objective facts rather than subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gun. Out with your gun.
Okay, this won't hurt. It'll be over in just a moment.
What's that?
Conductant.
Oh, dabble, do you? Right, Mr. Jackson?
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well?
Now just bite down on it.
Oh.
That's right. Just bite down. Now bite down on it.
Good. Are you ready?
Ready.